This is Dr. Cal Shipley with a review of endocarditis, cardiac valve vegetations, and stroke. Endocarditis can occur when there is fungal or, more commonly, bacterial infection in the bloodstream, a condition known as septicemia
Multiple
or sepsis.
sclerosis, MS, is a disease
As the organisms travel through the heart, they attach
the
themselves
CNS,
to the valve
which
leaflets
consists
between
of
the
the
heart
brain,
chambers.
spinal cord, and optic nerves.
The oxygen and nutrient-rich
Everything we do,
environment found
whether
in
it's
the left
taking
side
a
of the
step,
heart,
solving a
results in
problem,
rapid
or
growth
simply
of organisms,
breathing,
which
relies on the
form
proper
clumps
function
known
of
as
the CNS.
vegetations.
To understand how MS may impact the CNS, we must explore the disease at the cellular level. In the brain, millions of
Unpredictably,
nerve
the
cells
vegetations
called
may detach
neurons
from the valve
continually
leaflets.
send and receive signals. Each signal is a minute but necessary part of intricate
Vegetations
CNS
are then ejected
orchestrations
into the
that
aorta,
culminate in
where
the
they may
actions,
travel up into the
sensations,
arteries of the
thoughts,
brain,
and
causing
emotions
obstruction of
that
blood flow
comprise
and
the human
subsequent stroke.
experience. Normally, the path over which a nerve signal travels is protected by a type of insulation called the myelin sheath. This insulation is essential for nerve signals to reach their target. In MS, the myelin sheath is eroded, and the underlying wire-like nerve fiber is also damaged. This leads to a breakdown in the ability of the nerve cells to transmit signals. It is believed that the loss of myelin is the result of mistaken attacks by immune cells. Immune cells protect the body against foreign substances, such as bacteria and viruses. But in MS, something goes awry. Immune cells infiltrate the brain and spinal cord, seek out the myelin, and attack. As ongoing inflammation and tissue damage occurs, nerve signals are disrupted. This causes unpredictable symptoms that can range from numbness or tingling to blindness and paralysis. These losses may be temporary or permanent.
Stem cells. The human body contains hundreds of different cells. It's very important to work.
Infective endocarditis is an inflammation of the heart. It can damage the valves of the heart muscle, or the lining of the heart. It's caused by bacteria that enter the bloodstream. Many common dental procedures, such as routine teeth cleaning, can cause minor bleeding that might allow these bacteria to enter your bloodstream. For most patients, these bacteria are harmless. But if you have a medical history that includes a heart birth defect, prolapsed valve, rheumatic fever, endocarditis, heart surgery, or other problems, we need to take special precautions to protect you. By prescribing an appropriate antibiotic that you take before your dental appointment, we can avoid the risks of endocarditis. If you have any drug allergies, or if you have questions or concerns about our procedures, please let us know. We want to protect you and keep your teeth
healthy. The human body contains
healthy.
organs such as bones, the brain, heart, and reproductive organs. The basic cells that give rise to all of the different cells in these organs are called stem cells. One type of stem cell is an egg cell from a woman that has been fertilized by a sperm from a man. This single cell, called a zygote, is the first cell in a developing human being. It's also called a totipotent stem cell because it can form any type of cell in the body,
The first message
as well
is
as the umbilical
we are
cord
going to
and
reduce and we
placenta.
propose to reduce
After a
antibiotic
zygote has
prophylaxis
divided a
only
few
in
times,
patients with the
it becomes
highest
an
risk
early
of
stage
endocarditis,
embryo
that is
called
patients
a blastocyst.
with previous endocarditis,
Embryonic stem cells
patients
come from the
with
cells
prosthetic
inside
valve,
the
and finally some
blastocyst.
forms of congenital heart disease. The second message is about diagnosis.
Embryonic
The
stem
main
cells
technique
are
for the
pluripotent.
diagnosis is echocardiography.
This means
we
they
underline
can
the fact
form
that
any
both
cell in the body,
transthoracic and transesophageal
but
echocardiography
not the
are
cells
needed.
in the umbilical
clinical
cord or
practice,
placenta.
what is important is to perform echocardiography very
In the lab,
early
embryonic
in the course
stem
of
cells
the
are
disease.
donated from
The last
leftover
point is,
embryos
probably the
created
most
during in
important, that
vitro
is the
fertilization.
indications for surgery.
In vitro
The three main
fertilization is a
indications
procedure
for
to help a
surgery
woman become
are
pregnant.
heart failure, abscess or perivalvular complications, and finally embolic complications. And The trend
Tratamiento.
of this recommendation is to recommend early surgery, but sometimes urgent surgery, that is during the first week after initiation of antibiotic therapy, in the majority of the patients who have an indication for surgery.
Conclusión. It is an infection where instead of the camera valves, suppressor therapy and sweating are the classic symptoms. When therapy with your hematopoietic system 6 weeks to completely eliminate therapy from the transfer and valves and physical ability, capacity, function, and quality of life in people with collection multiple sclerosis. Although not cure the disease, stem cell therapy seems to be becoming effective for multiple sclerosis to improve disability, treatment of those effects, and therefore the quality of life. Ay, peluchita, dañaste el video. Acute osteomyelitis in children. Staphylococcus aureus is responsible for 17 to 19 of acute osteomyelitis in children. Usually, the site of the infection is localized and tubular bone and blood vessels are metastatical, which commonly suffer the initial impact. Clinical manifestation. Most patients develop bone pain for 1 or more days, steady and gradual onset. The pain is usually fluctuating depending on the posture and movement. Infant children is localized, which is not often seen in infants or well present with pelvic osteomyelitis are localized in blood bone and only in 25% of cases affect or tubular bones or nerves.
It's a condition that can strike an otherwise healthy child, but knowing the symptoms of osteomyelitis can make the treatment much more manageable. We find out more in today's Health Matters. Bacteria, it not only lurks on doorknobs, keyboards, and playgrounds, it lurks in our bodies, whether we like it or not.
Everyone has a little bit of bacteria traveling around their system, and that can be caused by something as benign as brushing your teeth.
Sometimes the bacteria can travel into the bloodstream and affect the bones, a condition called osteomyelitis. Children are the most vulnerable. Pediatric orthopedic surgeon Dr. Matthew Wagner demonstrates how a child's knee can be affected.
They have leaky blood vessels. The endothelium are the cells that cover blood vessels, and they're not as tight, making this transient bacteria that's in all of our systems a little bit more likely to exit in these areas. The knee, in a skeletally immature patient, is affected in over 50% of spontaneous acute hematogenously spread osteomyelitis.
As Dr. Wagner explains, the bacteria can spread dramatically.
Once it has established itself within the bone itself actually has a network of what's called perversion canals that allows cells within the bone to communicate with each other. The bacteria can then use that to communicate.
That's when children start to show symptoms.
Which is probably one of the most common is pain in an extremity, limp, especially in young children where they can't tell you, Mommy, it hurts here. You will see them favoring one leg. Certainly there can be swelling, there can be redness over the area, and fever. These are some of the more common.
Symptoms should not be ignored. Osteomyelitis can be treated with antibiotics. For those with more severe cases, surgery may be in order. I'm John Bafar. Infants can also be affected. The infection can spread to the joint and cause arthritis.
Diagnosis. The initial diagnostic is based on clinical suspicion. Erythrocytes sedimentation grades. Cultures of bone. Fine fluid and blood cells are helpful. The imaging study included radiography, scintigraphy, and in some cases, ultrasounds of the MRI.
this video, you're going to learn about osteomyelitis and how it's treated. Osteomyelitis is a type of bone infection caused by bacteria that can affect almost anyone. Children who become infected usually have their long bones affected, particularly the bones in their legs. Adults typically see infection in their vertebrae and hips. Since almost anyone can become infected, it is important to understand what some of the risk factors are. Contributing risk factors for osteomyelitis include circulatory problems, including diabetes, artery disease, and sickle cell disease. Recent injury, like bone fractures and punctured wounds. Use of street drugs, non-sterile needles creating puncture wounds near the bone. Osteomyelitis can cause quite a few secondary complications. In children, osteomyelitis can damage the growth plates, which can lead to impairment in growth. Occasionally, the infection can move to the other joints, causing septic arthritis. In the worst cases, the infection can cause the bone to die due to a decrease in blood supply to the bone. Treating osteomyelitis can be a long process. Orthopedic physicians may suggest starting with a bone biopsy to help choose the best antibiotic to treat the particular infection. Antibiotic treatments usually last around 6 weeks and are administered through an IV. Many cases of osteomyelitis require surgery. Surgery may be done for a variety of reasons, including draining the infection, removing infected bone, getting blood back into the bone, or, in the worst case, amputation. If you are experiencing bone pain, a fever, and swelling, it is imperative to see an orthopedic specialist. The physicians at the Illinois Bone and Joint Institute are some of the best orthopedic doctors in the Midwest. Their experience and training in treating all types of orthopedic conditions, including osteomyelitis, make them your best choice for orthopedic care.
Tratament. Antimicrobial therapy solve institutional and health costs. The effects bone spirits for culture shall be antecedent inflame the blood culture is positive. Incision and drainage shall be actually managed with their supradomestic access. Antibiotic would frozen efficacy and by Staphylococcus aureus include anti-staphylococcal, penicillin, clindamycin, third generation, cephalosporin, and vancomycin. Conclusion, depending on the early diagnostic and treatment, mortality is low and complication rates approximately 5% because of the various course of the disease is recommended. The treatment is individual for each case. Antimicrobial therapy should be institutional in all cases. The effect on spirit for culture should be antecedent while the blood culture is